We're in the process of looking at plans for the Uxbridge site for the future. The current building is old and renovations or repairs would be very difficult. So we believe that the best option for Uxbridge is a rebuild of the facility. And so we're being proactive and we're starting the planning process now. The planning process is quite involved, and right now we're getting ready to make a proposal that has two options. Our first option and our preferred option is a rebuild of the current services that we have at the Uxbridge site. Our alternate option is for an emergency center. Both of our options would include enhanced services like access to more diagnostics and other specialty services. We need to have a couple of options for the ministry submission. The ministry and the LHINs expect us to explore a number of options. Our preferred option is to rebuild the services that we currently have at the Uxbridge site. An emergency center provides access to emergency services. Usually it's in a rural community, and typically we have access in an emergency center to a broad range of healthcare team members that could include paramedics, nurse practitioners, and other health providers. It can be open 24/7 and it can also accept ambulances. An emergency center provides access to emergency services, but it may not meet all of the requirements to actually be called an emergency department. However, it would probably have all of the elements that people would expect to receive in an emergency department, such as extended hours or 24/7 access to care and access to necessary diagnostics. The difference between an urgent care center and emergency department can vary quite considerably. Urgent care center models vary from a clinic that looks very much like a walk-in clinic right to the other end of the spectrum, where you would see services very similar to what you would expect in an emergency department, such as extended hours of access and access to diagnostics and other specialty services. We're talking about urgent care because the ministry and the LHINs asked us to explore a number of models, including urgent care, to see if urgent care might be a workable solution for the Uxbridge community. In dialogue with our community, we've come to the decision that our preferred and our best option is a rebuild of the current services we have in Uxbridge, which includes an emergency department and acute beds. That's a great question. We have changed our thinking, and quite frankly, we listened hard to what the community told us they wanted and needed, and so our submission has changed, and we will be making a proposal to the LHINs and the ministry for a rebuild of our current services at Uxbridge that will include an emergency department and acute beds. No, the emergency department is not closing. This is a long process. All of the services and the programs that currently operate at the Uxbridge site will continue. We have to understand that this is a long process. It takes several years, and so there won't be any changes in the programs and services we offer for many years, most likely. There's lots happening with respect to planning for the Uxbridge site. The next step is that we will make our submission to the LHINs and to the ministry, and then we will spend the time after our submission talking to our key stakeholders, our staff, our physicians, and our community about the future plans for healthcare in Uxbridge. It's a great question. How can you be part of this process moving forward? We really need to engage with all of our stakeholder groups and our community, and we want to hear from you. So if you have any questions, if you have feedback, ideas, input, please let us know and reach out to us. You can email us at myhospital@msh.on.ca.